We're speaking today with Dr. Anthony Fauci, Chief Medical Advisor for the Biden administration's COVID-19 team and Director of the National Institute for Allergy and Infectious Disease at the National Institute of Health, which he has led since 1984.
Dr. Fauci has directed research on HIV/AIDS, on SARS, Ebola, Zika, and now COVID-19. His team has been researching the science behind the mRNA vaccine for years. Dr. Fauci, welcome back to Conversations on Healthcare.
My pleasure. Good to be with you.
You know, we're just a few weeks away from July 4th. President Biden has set really a great goal of 70% of Americans receiving at least one dose of the vaccine by that date. And I think it's fair to say we're on the 10-yard line, or it seems like we're pretty close. I wonder if you could talk about the collective effort that made this possible. And also, it seems to me, without the mRNA vaccine, what this remarkable and elegant science has put together, we may not be where we are today.
Well, I think certainly with regard to the latter question, Mark, it's true. We have been very fortunate that the investment that has been made in basic and clinical biomedical research, both in the platform technology, namely mRNA, among others, as well as the proper configuration of the immunogen, the spike protein in its right conformation to be highly immunogenic, has led to spectacular success with vaccines in the sense of high degree of efficacy in the clinical trial and effectiveness in the real world setting. So you're absolutely correct. If we did not have that successful investment that went back decades, we would not be where we are right now. That's for sure. With regard to the implementation of the vaccine plan, President Biden has made this a very, very high priority, literally from the very first day and even before he was inaugurated. And it has to do with mobilizing all of our assets to get people the convenience of being vaccinated. Community vaccine centers, federally qualified health centers, 40,000 pharmacies, no longer needing a computer to sign up, just go in and get vaccinated.
That's right.
Mobile units to go out, but also creating what's called the community core, which is the core of individuals who will be trusted messengers to get out into the community, a greater degree of outreach to the brown and black community. I mean, I myself have probably spent, dozens and dozens of interviews like this with leaders of the black clergy, the black community, the black business community, black sports figures, just to make sure that we get black and Hispanic people there understanding why it's important to get vaccinated. So this success that we're seeing, where we have 50% of the adult population already vaccinated, 64% of the adult population receiving at least one dose, is not an accident. It happened by a lot of effort.
Well, you know, Dr. Fauci, I don't know that we as a country or as a people have ever learned so much so fast, put into action so many things and pivoted to make it work. Couldn't agree with you more, and we couldn't have done it without the science that led up there. So we are very excited about how successful all of our vaccination efforts have been here in the United States. But with a window on the world, it is such a just huge tragedy to see how difficult this is in so many parts of the world. The G7 summit leaders announced a donation of 870 million vaccines to the world's poorest countries, and that came right after the Biden administration donation of 500 million. But tell us about this effort to get vaccines to billions of people around the world who are in greatest need. Is there a chance that that will be effective on a global scale the way it's been able to be effective on a national scale? Is there an infrastructure there to take those vaccines and get it into the arms of the people in those countries?
Well, Margaret, that's a good question, because there are two elements to getting the global response. One is the doses themselves, is to scale up, particularly in those companies that have the capability of scaling up by putting a major investment. I think we can do that. I believe that we can get billions and billions of doses in the next year or two. We want to do it as quickly as we possibly can. I think what the But President Biden's first step towards that was really a very, very important move because, as he said when he landed at the Air Force Base in the UK, that America is back. And that means back in our leadership role. So when we do something like 500 million doses, the rest of the world follows up because we're not going to be able to do it alone. The United States is not going to be able to take care of the rest of the world alone, but we can be an important leader in doing that. The second part of the point you're making is a very good one. What about the capacity, the absorptive capacity of these countries? And, let's look at the history of what we've done globally with vaccines, with polio, with smallpox, with measles, what we've done with PEPFAR and the Global Fund with drugs to individuals in developing countries, particularly in Southern Africa, has been very successful. So although one might think, well, many of these poorer countries don't have the capacity, you'd be surprised what they can put together. So I have faith that if we get them the doses, they'll be able to implement the program.
You have said to us before that the coronavirus, expect mutations out of it. We see the Delta variant is leading to spikes in hospitalizations in the UK and Germany and elsewhere. But the good news, it appears, is that the vaccines have shown some promising protective nature about at least that variant. Trying to connect, at least for our audience, the importance of what we just talked about in terms of this policy to make sure that we're addressing the global pandemic, because when people aren't vaccinated, these variants will continue to mutate. What do you worry about in terms of variants in the population that's unvaccinated around the globe and how that impacts the United States?
Well, Mark, a couple of very important issues you bring up. I think the first one, that we're fortunate in that the vaccines that we have available right now work quite well against the variants, including the 617. Because we know now from the study from the Pfizer drug, at least, that it's about 88% effective. So we're in good shape with regard to the vaccines that we have. Getting back to the issue is that a global pandemic requires a global response is really important, because as you are correctly saying, if we get the level of infection very low and we get the overwhelming majority of the population vaccinated in the United States, and a large proportion of the rest of the world, particularly in the lower and middle income countries, are not vaccinated, that is a surefire way to generate additional new variants. And we may not be so lucky the next time around that the variant that emerges is one that our vaccine is able to cover. It may be that it eludes the protection of the vaccine. So we've been fortunate thus far, but we can't count on being so fortunate forever, which means we've got to get the rest of the world vaccinated.
Well, on the front of getting everybody vaccinated, we're excited to move down to the 17 and old group, and then the 15-year-olds. We're vaccinating the 12 and up kids now. Very exciting. And know that the trials are going on to look at approving children as young as 5, and that might come as soon as September, I understand. But what kind of data are you seeing in terms of safety and efficacy for young children, and also number of doses? Do we have any reason to think that kids will need boosters, that adults will need boosters? What do you think we'll see?
Well, a couple of questions there. First, with regard to adolescents, the 12 to 15, we have clear-cut data on that it works really very well in them. And the original Pfizer study had essentially 100% efficacy in that group of adolescents. Amazing. From 12 to 15. It's really, really good. Thus far, the safety profile looks really quite good. You'll always have a very rare adverse event, but if you look at the risk-benefit of adverse events compared to the benefit of the vaccine, it's overwhelmingly in favor of the vaccine. With regard to boosters, we will likely need a booster shot for durability of protection, not necessarily for the height of protection, because these vaccines work very well. Mm-hmm. But unlike measles vaccine, which is essentially lifelong protection, we probably are not going to see that. So likely after a year or so, we don't know what that's going to be, Margaret, whether it's
Sure.
going to be a year and a half. So we likely will need a boost, whether it's going to be a regular boost or just maybe once every few years. We don't know. We're doing the studies now to determine what the need would be, number one, and what the right boost approach is.
Dr. Fauci, I'm wondering if you can give some advice to healthcare organizations like ourselves that are trying to address our staff's concerns and also to deal with the science. Many of us are laying out standards that require people, like we do with the influenza shot, to be vaccinated, except for religious or medical exemptions. Do you have some advice to healthcare organizations all across America on the standards they should employ?
Well, that is, as you probably well know, Mark, going to lead to a lot of controversy because the idea about mandating vaccines, it's not going to be done centrally by the federal government. But I'll guarantee you that there are going to be organizations, maybe universities and colleges, maybe airliners, maybe cruise ships, and certainly certain healthcare organizations might in fact mandate that you have to be vaccinated. In fact, there was a recent lawsuit that where they tried to prevent a mandate of vaccines, and it turns out the lawsuit was lost. And people really had to get vaccinated if the institution that you're associated with requires it. I think it's going to vary greatly from state to state because already some governors are trying to get laws through that says you can't mandate vaccinations.
Dr. Fauci, I wonder if I can get you to comment on another area that I know has been of great interest and concern to you, and that's minority representation in research over the years. Certainly, we've seen the impact on minorities during the COVID pandemic, but we also want to make sure that there's minority participation in the COVID vaccine trials, and I know that that has been somewhat successful. But I understand you're seeking a much broader role for communities of color at the NIH with the All of Us research program. And we wonder if you could just take a minute to talk about what's going on there and why that's so important.
Oh, yeah. I mean, the NIH has now made a major commitment, not only for minority representation among us, but for minority health and equity. We have an institute, the National Institute of Minority Health Disparities, which in fact is devoted completely to guaranteeing that we have the wherewithal to make sure that there are disparities that are addressed right up front in a very serious manner. So the NIH is taking this really very seriously, from the director right down to the people in the trenches.
Talking about public health, we're in the midst of doing mass vaccinations, and those are starting to roll down now. We're doing more door-to-door. But talk about the infrastructure that we need to have in place. We have a childhood vaccination distribution program in America. We don't have one for adults. Wondering what your thoughts are about how we learn from this gap that we had in terms of the investments that we need to make in our local and state health departments.
Well, you just hit something that is very, very important. You're absolutely right. The infrastructure for childhood vaccines is infinitely better than any infrastructure. So we have got to integrate the idea of adult vaccines right into the healthcare system. Many physicians are doing that right now, making sure and encouraging their patients. But that's their patients. You've got to have an infrastructure that goes beyond requiring a physician. You've got to be there, available to be able to give vaccines for people who don't necessarily have the accessibility of a physician that they could call up. Mm-hmm. So we have a ways to go, Mark, because we haven't solved that issue yet of a structure to get vaccines like COVID-19 vaccines and pneumococcus and zoster and all the others that we need to get adults to get.
Dr. Fauci, I know we don't have much remaining time with you, but I have to say it's been 40 years since HIV/AIDS was declared a health threat. We've been on that journey with you over these last 40 years since the beginning. And I think that you have predicted a cure is possible within 10 years. And you point to the dramatic scientific collaboration around COVID as proof of what can be accomplished. What say you about this? Do you think this is possible 10 years?
Well, I think there are two issues with regard to HIV/AIDS. One is a vaccine. And I think what we've learned from the extraordinary technologies that have allowed us to succeed with COVID-19 vaccines are going to be readily applicable to HIV. I think HIV vaccine work and attempts is going to get a very positive shot in the arm from the work that's been done with HIV, with the COVID-19. It's going to be a little bit more problematic with the cure. I mean, we have spectacularly effective drugs against HIV, one pill a day, and you can suppress virus to below detectable levels, something we wouldn't have imagined, in the beginning of the outbreak. But to actually eradicate it from a person, I think it's doable, but it's not going to be easy. But we'll continue to try.
Dr. Fauci, thank you for your lifelong dedication to eradicating infectious diseases, your heroic work in the face of the pandemic, and for joining us today on Conversations on Healthcare.
Thank you very much, Mark. Thank you, Margaret.
Thank you.
Take care.